Good morning, everybody. My name is Brian Cummings, and I'm here to introduce our web talk today, Creating a Stigma-Free Workplace. I have Nicolas Emeigh on, and he'll be presenting. But first, I want to introduce Billy Barnes, Executive Director of Workforce and Economic Development. Good morning, Billy.
Thank you, Brian. Good morning, everyone. I'm Billy Barnes, Executive Director of Workforce and Economic Development. On behalf of the Bucks County Workforce Development Board and the County of Bucks, I want to welcome everyone to WED Talks. Since we launched this initiative last summer, workforce experts have shared their experiences with innovative approaches to improving workplace efficacy. We've covered 9 topics so far, focusing on best practices and effective collaboration among stakeholders. Today, our WED Talk will focus on creating a workplace free from the stigma associated with mental health. But before we get started, I want to tell you about Bucks County's leading voice on mental health and recovery. Since 1983, the National Alliance on Mental Illness has been at the forefront of the mental health movement, providing support, education, and advocacy to ensure people in the greater Philadelphia area get the care they need and deserve. NAMI's vision of recovery for all people affected by mental illness is based on hope, inclusion, and empowerment. Together, we can remove barriers and help our families, friends, and colleagues get the help they need to live healthy, fulfilling lives. Thank you. Brian, kicking it back over to you.
Great, thanks, Billy. All right, I'm going to introduce our speaker, Nick Emeigh. I'm pleased to introduce our WED talker, Nick Emeigh. Nick is a mental health advocate and public speaker who proudly serves the community as Director of Outreach and Development for NAMI Bucks County. They provide help, hope, awareness, and opportunities to Bucks County's 640,000 residents. Nick has frequently been called upon by local media outlets for comment as a fierce advocate for people living with mental illness and substance abuse disorders. He often speaks at conferences, schools, institutions of medicine, and higher learning on the power of peer support and about his own journey through an intense battle with mental illness and what he's doing now to help shatter this stigma so that no one feels alone on their journey to recovery. He also works closely with local officials and legislators to help them understand and remember just how important mental health is. Nick serves on several boards and committees, including the Bucks County Behavioral Health Advisory Board as the Vice President, Bucks County Suicide Prevention Task Force, Community Support Program of Bucks County, the Transition Age Youth and Young Adult Work Group, the Young Adult Advisory Board, and as a peer on various care coalitions and direct service advisory boards and committees. Welcome, Nicolas. Thank you for leading our discussion today. I'll kick it off to you.
Thank you for having me. I'm sorry that you had to read that whole thing. And I'm sure that, and good morning, everyone, and thank you for joining. I'm sure that you heard in that everything that I do and everything that NAMI does, we work to educate the general public and support them and provide advocacy to them. And one of the areas that we felt was lacking in training and education was our workforce in Bucks County. And so we created a program called Creating a Stigma-Free Workplace, and in that program is another practical program called CEOs Against Stigma that was developed by our state organization to address the gap in services and supports that exist in the workplace and the general understanding of mental health as it pertains to the workplace. And the way that we identified this need was in all of our support groups that we offer, in our education programs, and on our helpline and warm line. People talk about their job and how it affects their mental health, and there was just a need for this. And so I'm excited to be here to talk about the importance of mental health, what it is, and what we can do about it in the workplace. So on the agenda today, I'll talk about NAMI first. Billy gave a beautiful introduction as to what NAMI is. Then I want to talk a little bit about what mental health is versus mental illness. There's a difference, and this part of the stigma that exists is the idea that if you talk about your mental health or ask for support for it or seek out services, that you are crazy or insane or there's something wrong with you or you're limited in your potential in the workplace. So we'll talk about what the difference is there. And then we'll talk about trends and insights in supporting your employees in the workplace, stress, anxiety, and burnout, and what the difference between the three is, and employee assistance programs. Then I'll give you a walkthrough of our CEOs Against Stigma program, and then we will have questions and closing remarks. And I think throughout this presentation, you'll be able to enter questions either in the chat or in the question box. So I'll talk a little bit about what NAMI is and what we do. We're obviously a 501c3 nonprofit organization, and our mission is the dedication to improving lives of individuals and families through recovery, focus, support, education, and advocacy. Last year in 2021, we provided support, education, and advocacy to over 41,000 individuals. And the way that we do that is we offer support group programs for individuals and families. We also offer our support programs to underserved populations or populations not served at all. And in places like our Bucks County Correctional Facility has been amazing in letting us in to provide the support that individuals there need. We also offer education programs for individuals, families, and school students. And we offer telephone support and text and chat support through our helpline and warm line. And we are home to the Bucks County Community Support Program, which is the advocacy arm of NAMI Bucks County. So you could see in here that, we don't often talk about the workplace. So that's why this program was necessary. And in working with companies like Johnson & Johnson has mental health days where we come in and it's an entire day of education, stories of lived experience and hope, and it's a day that we make of that. And I didn't want that to be unique to just Johnson & Johnson. And the reason that I want to talk about the difference between mental health and mental health conditions or mental illness is that it is so commonly mistaken. So mental health, everyone has mental health, and mental health is on a spectrum. So we've got mental wellness, which we can work to maintain, and then everyone through lived experiences a continuum of mental health challenges, mental health issues, struggles, grief, loss of a job, loss of employment, struggles at work, things like that. And all of that affects your mental health. That doesn't mean that you have a mental illness if you struggle with your mental health or a mental health condition. So everyone can have these moments where we don't have optimal mental health, and it's no different than physical health. If you break your arm and you go and have it casted, that doesn't affect your health for the rest of your life. Well, hopefully it doesn't, but you get it casted, it heals, and you go on living. With mental health and mental illness, having a stressor or a moment in your life where you lose something or someone that affects your mental health, that may not affect you for the rest of your life. We have mental health conditions also that can be chronic, or they can affect you in a moment in your life, and then we grow and heal and move on from them. So a lot of what we'll talk about today, and especially the supports and resources that are available, don't always have to involve medication, and they don't always have to be forever. So many people, like it says, have time to time concerns, but a mental health concern only becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. So on the side here on the right, you can see there is a spectrum of mental health that we can go through. We can be flourishing, we could be flourishing with mental illness. And if you look at me and you registered for this webinar, most people might not know that I live with a mental illness called schizoaffective disorder. And I'll tell you, one of the biggest things that has helped me in my recovery from that mental health condition is the way that people have treated me in terms of working here for NAMI. You know, there's no one that I've encountered along the way, including Billy. I want to thank Billy and Brian and everybody here who invited me today to speak. No one hears my story of, you know, struggling when I was young, going through grief and loss. I lost my mom and dad, struggling with my own mental health and, you know, surviving suicide attempts. When you hear that story, stigma sounds a lot like implicit bias or discrimination. So there was a choice here. So Billy could have heard my story and said, you know, I think Nick might be a good speaker for a WED talk, but I'm not sure because he's got a mental illness and it's pretty serious. So I don't know if we could depend on him. I don't know if we could trust him to talk. But Billy didn't do that, and NAMI didn't do that either, and members in the community never did that. So that has helped me because there is an internal stigma as well. You know, I come on here and I wonder, can you see my mental illness, and are you judging me for that? But what I would like you to know is that I don't regularly tell people that it gets better because, you know, the proof is in the pudding. So I am the proof that things can get better. And I would say that I am currently flourishing in my mental illness. So I'm doing well, things are going well, and that there's a lot that goes on behind the scenes to make that possible. So I want to talk a little bit now about the trends and insights that as they pertain to mental health in the workplace. And although you're on the call and you may not be a CEO or a leader of an organization, anyone can be a champion for mental health in the workplace. But I think these insights are interesting. You might think that all leadership thinks that it's a weakness to discuss mental health, either their own or in general, but over half of CEOs say that talking about mental health makes them a better leader. 90% of employees appreciate that a leader will talk about the importance of mental health or their own mental health, which is even better because we all have it. The only thing better than just talking about something and being a champion of it is relating your own experience. And at NAMI, the most valuable credential that we have is our own lived experience, and it makes it relatable. A question I often am asked is, how do you get people to talk about mental health? Like, you know, parents reach out for me to support their kids or them. Individuals reach out and ask for support, and others might wonder, how do I get people to talk about it? And it's I talk about my own. The best way to you know, make someone feel safe is to let them know that they're not the only ones going through an experience and that I have gone through it too. The interesting part about that first box there, half of CEOs say that talking about it makes them better. 90% of employees appreciate it, but out of that 90% of the employees that appreciate it, they still are hesitant to talk about mental health because they are afraid that it will affect their credibility. So the way that leadership thinks about them. 94% of CEOs say that they've received mental health support themselves over the past year, which is great. 92% of CEOs report that their companies have increased focus on mental health as a result of the pandemic. If we were having a discussion here right now, I might ask all of you, what's being done in your workplace as the result of either the pandemic or just the increased focus on mental health in general. And then 80% of CEOs believe that poor employee mental health negatively impacts worker productivity. And it absolutely does. The leading cause of disability worldwide is depression, and we'll talk about some of the statistics related to productivity and lost revenue a little bit later. But most CEOs believe that this is a valuable conversation to have. But whether we're having it or not is the question. So the problem here is that the average worker is far less likely than the CEO to feel that their company does enough to support mental health. And in the organization, the more senior the employee or worker, the more likely they are to think that their company is doing enough. So the closer they are to the top, the more likely you are to think that your company is doing enough. 96% of CEOs believe that they're doing enough, but only 69% of employees feel the same way. And that's interesting, because things might be being done in your workplace, but if your employees don't know about it, or if you're an employee and your leadership team has instituted wellness policies and employee assistance programs, but you don't know about it, you're likely not to feel that your company is doing enough. The average worker is half as likely as the CEO to say their companies are just generally accepting of mental health issues. And not to say that your company is not accepting of mental health issues, but if there is no conversation had or awareness around the topic in general, for whatever reason, your employees aren't going to think that it's okay to come forward and talk about it or ask for the help that they need. Individual contributors report that their companies offer mental health benefits only half as often as CEOs do. It's not that the benefits are offered only to some people, it's that some people don't know about them. It's you know, I don't know if everyone on the call has an HR department, if you're in a smaller organization, but I think if I were looking at this as a leader of an organization, I might think, well, we are doing things, but if it's not a conversation that's had, people can't know what they don't know. So 95% of people who received mental health support over the last year reported that it has helped them at work. It's one of the biggest topics in our support groups is work, the pressures of work, the stress that comes from work, the good things that can come from work. In mental health recovery, having a purpose is hugely important. So it's helping people to get support. So I want to talk about stress, anxiety, and burnout. So the symptoms of stress and anxiety, as you'll see on the next slide too, are largely similar, but stress is external and can go away, and it can be based on an event, it can be situational, and once the situation is over, the stress can go away. So stress is external, and the way that we respond to stress or the way that we feel internally is anxiety. So the symptoms and the signs are largely the same. It can manifest physically in fatigue, headaches, infections in the body, chronic infections. It can look like not sleeping, not eating. It can look like ways of coping with it. It can look like substance use. In my story, a lot of my life, I coped with stress, anxiety, and just mental health in general with substances, and I medicated myself because human beings need to feel better when they're exposed to stress, especially if it's prolonged stress. And the danger of prolonged stress that may feel good and natural in the beginning and progresses to, you know, I have so much to do, there's nothing I can do about it all at once, and it's hard for me to prioritize, and then you don't get anything done, you feel guilty, there's more stress, and then it just snowballs until you get to the point of a crisis. But the danger of that is if it's not managed or addressed by either seeking help from the employer or by seeking help independently outside from a therapist or a psychiatrist, it can turn into a diagnosable mental health condition like burnout, which is officially recognized as a mental health condition. These symptoms of burnout can feel a lot like stress and anxiety, but stress and anxiety, the symptom is fatigue and being tired. But if you've ever been exhausted, you know the difference between tired and fatigue and exhausted. A lot of people have had COVID and they're experiencing long COVID. And a symptom of that is chronic fatigue. So, you know, this working through a pandemic has been really tough on people. So another difference and a distinctive element of burnout is an employee or worker who was once enthusiastic about the job and so excited about the job, always was on time, always completed tasks, met goals and deadlines, but now is unable to do that. And it's not a permanent situation. It doesn't have to be, but it can result in poor performance at work. And it just looks like someone doesn't care or has lost interest, but there's a reason for the loss of interest. And there's a reason for the lack of care and ability to meet goals and deadlines. And then it can ultimately be a complete inability to do the job. So what do we do about this? We're going to talk about a little bit later. But it's important to recognize the difference between stress and anxiety. And here's a little graphic to talk about, you know, the difference between the two and where they intersect. So like to reiterate, stress is a response to something external. It can go away once a situation is resolved. And none of this becomes a mental health condition unless it is prolonged, it lasts, it doesn't go away. Despite your best efforts to control this, it doesn't turn into a mental health condition unless it affects your daily life overall. So this is a helpful graphic, and all of this I'll make available to anybody who would like it after the presentation, and there's more resources that we have available as well. But to reiterate again, anxiety is the internal feeling, and anxiety can exist on its own as a disorder when it's not prompted by anything external and it's constant worry and constant or persistent dread, worry, and it interferes with everything in your life and how you live. So how do we deal with this, and what do we do to help people? So it's important that you understand that treatment and support works much better when someone is educated on mental health in general, something like we're doing today, just a mental health 101. It's not knowledge that we're born with. And like we said, we can't know what we don't know. So how we help when we're so busy is we have the assistance of an employee assistance program. So an employee assistance program, and they're different. Not all EAPs are the same. An employee assistance program, confidentiality is an important aspect of it. It's a confidential workplace service that offers free or discounted services, either short-term or longer-term, depending on the plan you've got. Counseling, referrals, legal services, financial services, and oftentimes EAPs will extend to the members of that employee's household as well. So employees' family members affect their life, which then comes into work. So if mental health affects everything in our life, and our mental health is affected by everything in our life, so it would then only be logical that this applies to work as well, the workplace. So it's really tough to do your job if you don't have the support that you need with mental health concerns, life stressors, and that's why EAPs cover this range of services and supports. And it extends to sometimes substance abuse counseling, grief and loss, crisis and trauma, and then budgeting, general, financial help, and any work-related issues, as burnout is on the list, and then relationship and family. So it helps with everything that would affect somebody's mental health. But I want to let you know that if you've got an EAP at your place of employment and you've checked the box and you're busy and you're back to your job, an EAP can't be effective by itself. It needs to be accompanied by education. It needs to be made an event if you have mental health events to talk about the importance of mental health, and it needs to be posted and available. So oftentimes employees won't come to leadership to ask for the help that they need because stigma exists, whether it's internal, like what I talked about earlier, or whether it's external, but it exists. And if an employee has easy access to this program and knows that we can call a number without talking to leadership about it, we lose a little bit of confidentiality if someone else needs to be involved to tell the employee, okay, well, you have this concern. If you're having thoughts of suicide, if you're struggling with burnout, a conversation needs to be had before they contact the EAP. It should be easily available. And the reason that the statistics in the beginning are as they are because most people don't know what to do when they're faced with a mental health concern, crisis, or anything like that. So just a testament to EAPs, my brother is an electrician and struggled with his mental health throughout the pandemic. And I know, working in this field, that therapy is wonderful, and I recommend therapy for everybody. I go to therapy myself. I have a psychiatrist. I personally take medication. But my brother struggled for the first time in his life, and he's 33 years old, 34, and he didn't know what to do, and he called me. And I know that there are wait lists for therapists and psychiatrists, and he called his employee assistance program, and they were able to get him right in to see a therapist and a psychiatrist faster than we could get them in to a community agency. And so oftentimes our community agencies in Bucks County are partnering with employee assistance programs, or they offer their own employee assistance program, and mental health is a huge part of the EAP, and you want to make sure of that. This is a lot. It's a lot of information. It's a lot to understand. And if you are busy, there's a chance that you might think this is just not something that I have time for. If an employee comes to me and expresses their concerns about their own mental health, is that an awkward conversation that I know how to have? Does it need to be awkward? Am I going to make it awkward because I don't know what I'm talking about? That can happen, and it's all right to feel that way. I know at NAMI, we do lots of things in terms of reinforcing wellness policies and programs that we have available. We're lucky at NAMI that we offer these groups and services so that our stipend employees, our part-time employees, and our full-time employees can participate in the support programs that we already offer. So that is nice. But in addition to that, and to be an example, NAMI does things like in the second week in April, we are giving all of our employees a paid week off so that they take time to prioritize their mental health. Do we need to do that? I mean, no, we don't have to do that. Can we afford to do that? Well, listen, our employees and our volunteers and our stipend employees are our most valuable asset. There is no NAMI without these people. And if we aren't letting them know how valued they are and how valued their wellness and mental health is, then we aren't really the example. So can everybody do that? No, but do policies exist in your place of work that allow for schedule flexibility, mental health days? You know, if an employee has a tough day, is there someone in your organization that they can come and talk to? Do you have a wellness committee? So those are some of the things that are addressed in the CEOs Against Stigma program. And how the program works is it works best if it's the top down. So it doesn't have to be the chief executive or the executive director. It can be the CFO or the human resources director or an HR professional who signs up for this program. And when you sign up for this program, you have access to a toolkit. And this program provides the education, and it's an extended version of what I'm doing today since I only have a half an hour, but it gives you the education and the language and the comfort to talk about mental health and develop policies and practices that prioritize mental health in the workplace. So, excuse me, it's $1 trillion per year loss in productivity when depression and anxiety are not addressed. So 8 in 10 workers with a mental health condition say that shame and stigma prevent them from seeking treatment. Now, depression doesn't always look like someone sitting alone in a dark room crying all day. Depression can walk around. Depression can be, you know, your best employee. So can anxiety. But the shame that comes with talking about it prevents people from getting the help that they need. 57% of employees with symptoms of major depression said that they've received treatment. So a little more than half, which is not good. 80% of individuals with depression reported some level of functional impairment. I don't know if anybody on the call has ever experienced depression, but it keeps you from doing the things in your life that you want to do, that you're good at, that help to keep you otherwise in recovery. 27% of individuals with depression reported serious difficulties, so serious impairment at work. It affects your ability to remember things. It affects your ability to concentrate. It affects your sense of urgency at work to get things done on time and on task. So the investment in this program is worth quite a bit of money. So the method that we use in CEOs Against Stigma is a CEO or leader signs in and makes a pledge to make mental health a priority in the workplace. And we give you an action plan, resources, sample policies, and I'm going to talk about what policies are in the next slide. But it's a whole toolkit of effective ways to implement mental health as a priority in your workplace. And there are surveys, there are resources, posters that you can put up, and events that you can plan. So it's a full supported roadmap to introducing mental health in the workplace and to do it effectively. I think Starbucks is a nice example of what can be done with a wellness policy plan, roadmap, and an employee assistance program. They offer their employees 20 therapy sessions a year, and that's almost twice a month that their employees get to have free therapy sessions, which is incredibly helpful. I go once a month to therapy. So the steps that are involved in CEOs Against Stigma, we have an overview that is similar to this, but it's looks like a lunch and learn, where we talk about the basics of mental health and what is working and what's not working in your workplace and what needs to be addressed. Then you come together and create a vision for your company, and then we talk about, you know, whether or not that there's an employee assistance program, how often it's used, do people even know about it? And are people in your workplace afraid to use the resources that are available to them because management will know? Someone will know. I worked in retail pharmacy before I came to NAMI, and I was afraid to ask for help for my mental health because I thought someone would be able to see that I used mental health services. I mean, it just, the fear is there. And are there any other resources that are offered? So a wellness policy, if there's one in place, if there's not, we help you to develop one. But is mental health included in the wellness policy? And is there a wellness committee? So do your employees have input as to what the wellness policy is and what resources are available and what's included in the EAP? Do they have input on that? And is there training? Because most mid-level managers feel that they don't have the resources that they need to support their staff. And then review the current people data. So what the turnover is like, sick requests, leaves of absence, missed work, lost productivity, and what can these numbers tell us? And then we do a program launch where we have, we've done with Johnson & Johnson, we've done events with our state office, NAMI Keystone. We have panel discussions regularly with CEOs and their employees, and it's a public presentation for everyone at the company. So those are the steps that we can take to start. And I want you to know that it's not the end of the conversation. We can sign you up for CEOs Against Stigma. We can come out and do wellness days like we do at Johnson & Johnson and in other places, and we can do talks like this that we're doing for a WED Talk, and just educate your entire workplace on the importance of mental health, what it is, and that there are resources available. And most of the data in this presentation came from an organization called Ginger, which is a largely virtual data-driven provider of mental health services. And the last thing that I'll leave you with is flexible thinking in terms of what mental health services look like. I just want to tell you that telehealth has become very popular during the pandemic, and it's not a lesser option in terms of therapy and psychiatry compared to in-person services. It's a preference for a lot of people, and it can ease the anxiety that goes into the process of entering the world of mental health support and treatment. So don't discount things because they're virtual. And this at least starts the conversation in terms of mental health in your workplace, your own mental health, and it'll get you hopefully thinking about what can be done to save money, improve the morale. Birthday cakes on birthdays and everybody signing a birthday card and things like that are nice for employee morale, and keep doing that, but there's more that we can do if you just have an EAP and nobody knows about it. Hopefully you're thinking about other things that we can do to raise awareness in your workplace. And ending the stigma means treating people like I've been treated, and not devaluing individuals because they struggle with their mental health. We all have mental health. We all may struggle at one point or another. And I'll always remember how I was treated coming up in this organization, and I will always pay that forward. And I hope you do the same. And next time you meet somebody with a mental health condition, just think, maybe they will end up one day as the director of an organization helping other people. So keep that in mind. These are ways to contact us. NAMIBucksPA.org is our website. My email is there. Feel free to reach out or call our office. Our warm line and helpline are free and available to everybody, as are our support and education programs. And you can always find us on social media, where I post things every day, and our daily schedules of groups and events at NAMI Bucks. And so I will open it up to questions. If anybody has any, I'd be happy to answer them.
Nick, thank you very much. This is fantastic. What a great topic and fantastic resources that you shared today. You know, I was taking a picture with my phone of this last slide. I know you're going to share it all, but I wanted to make sure I got it. This is really great. I want to thank you. And I'll check in to see if we have any questions. Deanna, do we have any questions there?
We don't have any questions right now. If anyone has a question for Nick, if you could put it in your questions feature in your control panel.
Mm-hmm.
Give it a few minutes. Nick, if there's any other closing remarks you wanted to say?
Well, I just want to let you know that this is what we do all day, every day. And so I think it just rolls off the tongue, and I know that we went quickly through this for the sake of time, but there's more that we're happy to help you and support your organization through if you're interested in doing this. And if you are somebody who is not in leadership of an organization, still reach, if this interests you and you think that this needs to be you need a wellness policy, you need an EAP, you want there to be talk about mental health in your workplace or organization, reach out. And while it does require buy-in from executive leadership, there's no reason that we can't, start a conversation and spread resources in your workplace. And then we will work up to the CEO and make sure that they understand how important mental health is. If we can get legislators to understand that mental health is important, we can get your CEO to understand too.
Thanks, Nick. We do have a really interesting question here.
Sure.
Thoughts on the trades and how it might be different than a corporate setting?
On the trades and how it might be different, as in which trades are we talking about?
Doesn't say right now. If whoever asked that question could put that, but I'm thinking any thoughts on the skilled trade environment of blue collar versus white collar?
Blue collar versus white collar. I would say the income level and level of trade doesn't discriminate against mental health issues. So the more money you have, it doesn't protect you from mental health issues or concerns or mental illness. The level of your job, white collar, I mean, if there's more stress, blue collar, if there's stress about income, finances, and everything like that, I would say that each one is equally important as far as education goes, because there are, I'm going to say this again, people don't know what they don't know. And so you can be the most intelligent person. I'm an intelligent guy, and I didn't get help for my mental health fully accept it until I was 32 years old, fully. And so, level of employment or rank in a company or blue collar, white collar, we all have mental health and it's important, but education is important too. So, a white collar individual who knows that they have access to everything and has, the privilege to access that, they may still not access the help that they need because they are afraid that individuals or their employers or their bosses will think differently of them if they seek that help. And blue collar, my brother, I would say, is blue collar. He's an electrician. He knows that I run NAMI with Debbie, and he still was afraid to reach out and talk to me and ask for help. And my brother described symptoms of a panic attack in physical ways. I'm having a heart attack. I'm pretty sure I'm dying. There's something wrong with my brain, in my brain. And but he has an employee assistance program. His HR director, I would say, did a fair job of helping to guide him. But I see an opportunity there. Hopefully they have us out to talk, but education is so important. If my brother didn't have me to talk to, not saying that I saved the day or anything, but if he didn't have me to just talk to and tell him, Tim, my brother's name is Tim, you're not having a heart attack, I hope. I don't think you are, But it sounds to me that this is a panic attack, and it sounds to me that, you know, we lost our mom and dad, and he never dealt with that. And so it sounds like that's coming up now, Tim. He lost his dog, you know, that's coming up. All of this piles up, and whether you're blue collar or white collar, it can result in, you know, some catastrophic consequences if we don't deal with it. So I know that you probably didn't ask for all those thoughts, Melinda, but you got them. And I hope that that's helpful. Education, education, education.
Thank you, Nick. Someone else asked, what is a good way to ask someone if they are okay? How can we make them feel comfortable talking about mental health?
I use I statements wherever possible. Start with I. If you start with you, lately you've been different and I'm worried for you. It sounds a lot better when you phrase it as, lately I've noticed that you, and give specific examples. So lately I've noticed that you are, you know, you're at least 10 minutes late to work every day. And when you come in, you look tired, like you're not rested. And I did a training with NAMI, and I learned that, you know, there's stress, anxiety, and burnout. And I just, you know, I want to talk to you about how your mental health is. And then if possible, wherever possible, give an example from your own personal experience that they might find relatable. Throughout the pandemic, and this is the truth, I have struggled with my own mental health because I work from home. Mental health is in high demand, and I've worked every day through the pandemic, and I lately had to place an importance on self-care and you know, seeking help from my therapist. So I wanted to sit down with you, address what I'm seeing, and then let you know that I care about you. And I'd like to talk about that if you feel comfortable. And if not, I can help you find the resources that you need for help if you need it. And the worst thing that can happen is that someone says, no, I'm fine, I'm okay, you know, everything's good, I'm just tired. And then you handle it accordingly from there. Obviously, people can't just be late all the time. And so say, you know, and then address it from there. But you know, chances are, even when people say that they're fine and you know that something's going on, you can still say, you do what you have to do as a leader of an organization, but still say, I'm here if this is a problem for you, and if you need support in it, I want you to know that I'm here. And then you still have to do your job, but at least that person knows that you care enough to have the conversation. And it helps tremendously when you have a relatable personal experience.
Thank you, Nick. The last thing is, someone asked if they would have access to this slideshow after the webinar. He said, I find this to be extremely informative for my executive staff. I will say that everyone will receive a recording within 24 hours, so you can always have that. I don't know if you're comfortable giving the slideshow out, Nick?
Sure. Yep, I made it for you, and so it's technically yours. So I'm fine with giving you that. I'm honored that you think it's informative enough that you'd ask for it. So sure. I do believe it fits in an email, so I can email it to you, and then you can email it out. And what I'll do too, Deanna, is give you some other resources to send out along with this that might be helpful.
Great, thank you.
You're
welcome.
welcome.
Then one last question is, someone asked, are there NAMI offices in every county?
Not every county, but there are 31 in Pennsylvania alone. There are offices locally around here: Philadelphia, Montgomery County, Bucks County, Lehigh, Berks, Scranton, Erie, Blair, Butler. There's quite a few, you know, in Pennsylvania. Not every county has one, and not all NAMIs offer the same things. So we all work together as an alliance. There's 600 of us across the country. So we're a network. So whatever you know, if you find a local affiliate that's closer to where you are, and they don't offer what you need, you can come to us and we will help to support you, or our state organization will help to support you. And then what I would recommend you think about is if there's a NAMI near you, or if there isn't, how do you start one? I would look into that. But how can you help that local affiliate that doesn't offer what you want? How can you help them to, you know, grow into a place that they can offer the program that you want them to offer? We at Bucks County, we work hard. We work hard and we work smart with 4 full-time employees and a dedicated staff of volunteers, and we're lucky to have that. We're one of the larger affiliates in Pennsylvania. But you know, just know that we all work together to support each other. And yep, reach out to your local NAMI. If you need help with that, just let me know and I'll be glad to help you with that. And my email is right there. So that's why I made this the last slide in the deck, so we could leave it up.
Thank you, Nick. That concludes the questions.
No problem.
Thanks,
Absolutely.
Deanna. Thanks, Nick, for answering the questions. I know that I had a couple questions and they were answered.
Sure.
So I really appreciate that. And what a great topic. I really can't thank you enough for your time today in this great presentation. Feel free to share your slide deck with me as well, and I can certainly share it with whoever asks. And I hope you have a great day. And one more thing before we all leave, I want to introduce our next WED Talk, switching gears a little bit. Please save the date for our next WED Talk on Wednesday, April 13th, entitled Global Supply Chains in the Post-Pandemic World. We'll have renowned expert Mark Miller. We'll discuss the supply chain in 2025, reflect on the COVID disruptions, and explore how China's changing role, logistics sector dynamics, and the Ukraine crisis will impact future post-pandemic supply chains. He will conclude with 10 practical strategies for business leaders to thrive in the next normal. Pre-registration for the WED Talk will arrive in your email soon. Please don't miss it.
Awesome.
One last thank you for you, Nick. It was great today. I really appreciate it. I had a discussion with my staff today about, you know, name one thing we learned recently. So I'm happy to say I learned some fantastic resources in Bucks today, and I certainly plan to share.
Oh, absolutely. My pleasure. Thank you for having me, and thank you everyone for joining us today.
Great. Thanks, everybody. Have a great day.